So another area for the new questions is something called positive outlook. Could you talk a little bit about what is positive outlook and why might that be important for chronic pain treatment?
Yes, so we know that our patients have a lot of mental health symptoms related to their pain, such as depression and anxiety. Another important area is their overall sense of optimism, and it's been shown that just their general sense of positivity, their general positive outlook in life, their optimism by itself, separate from any depression or anxiety, are really important to treatment outcomes. And it's something which the provider can enhance and talk to the patient about, we think, a little more easily. So if you see someone with a low positive outlook who's not very optimistic at all about their future and their life, you could suggest to them that to be hopeful and that there are some things to be hopeful for and what you're going to work on with them. And just bringing it up that you're paying attention to their optimism, we think is really important. Even if you don't have the magic answers, you're not going to make someone who's very negative into this booming positive outlook person, but I think bringing up and making it clear to the patient that these factors are important and you want to consider them, and you're asking the patient to reconsider their own negative outlook, we think that'll go a long way to improving their overall treatment outcomes.
Thank you. So, how would you respond to a patient who comes in to you and says, "Well, why do I have to answer these questions about positive outlook? You already asked me about depression. It's the same thing, isn't it?"
Well, it might seem that positive outlook and depression are the direct opposite of each other, but they're also distinct from each other in a couple of different ways. So patients can say that they have a low mood, they feel sad, they can't enjoy anything, but also say that in general they're optimistic about their future and overall they feel that their well-being is good. Believe it or not, the way the patients respond to these different questions, they don't respond to them as if they're totally the opposite of each other. They actually have somewhat more interrelated and different trajectories at different times. So we think that addressing their optimism in general could be another significant way to address some of the problems that are important to pain.